There are now more than 10,000 peer-reviewed academic papers looking at the science of mind-body medicine, with more research being published daily. And with it comes the molecular underpinnings of emotions and disease, proving a mind-body connection. And yet in most conventional medical centres, the mind is not a component in a treatment plan. Millions of people are being turned away from doctors' rooms with potentially curable chronic illnesses.
Hi, my name's Scott. I was diagnosed with melanoma in 2000. I think looking back, I was a bit of a worrying sort of person. Not so much worried about myself and where I'm going to be in 10 years, but I think I just worried about stuff. You know, a bit of a perfectionist by nature, and I don't know, I just probably obsessed a bit about my life and how this worked and how that worked and whether that was a good way to do things and things like that. My doctor never gave me a prognosis, but I did ask him. You know, I said, how unwell am I? And I think I said, how serious is this? And my doctor said it doesn't get any more serious. My doctor was happy to call me a terminal patient. You know, I was unwell. I had stage 4 melanoma, and people with stage 4 melanoma didn't get better. And my doctor said, well, look, you can have chemotherapy if you like, but it's only got a 5 to 10% success rate. He said, but that's all I've got for you. They offered me chemotherapy as a palliative treatment, and that's all they had for me. I never looked to myself. You know, I just looked to the medical system and whacked a drip in my arm and sat there and said, she'll be right, mate. Like, that's the mentality that I had. But I wasn't right because it kept coming back.
I think there's an art in how you approach a patient. The words that a doctor uses have great power. I've written also about what I call medical hexing, which is the negative side of this, that many patients have been told by doctors in one way or another that they're not going to get better. Often doctors haven't, meant to do that, and they may even be unconscious of what the things that they've said. But I think this is an area that needs correction, that doctors need to be aware of how powerful their words are and to use them, to promote healing rather than hinder it.
Medicine used to be a trade. It used to be that you would apprentice yourself to a doctor and roam around with mostly then him, not her, and learn the craft. At the beginning of the last century, there was a report called the Flexner Report in the United States that said, medicine should be a science. And so people started going to formal medical schools after university. But I think in an odd way, we solved one problem and created another, because the old general practitioners, they understood the importance of emotional support as well as whatever medication or surgery you gave. So the oldest adage of medicine is that our job is to cure rarely, relieve suffering, and comfort always. And in the Flexner era, we rewrote that job description to be that our job was to cure always, relieve suffering if you had the time, and let someone else do the comforting.
We've started to look at the doctor-patient interaction, and then even more broadly, this ritual or theatre even of healing. What is it that we do when we prescribe a medicine or see a patient about a surgery or even conduct surgery? What is in that environment and how does it affect a patient's brain? There's a couple of trials which have been done by a colleague of mine in Italy, Professor Benedetti, in the early 2000s, and they were able to look at post-operative pain with a drug, morphine, and were able to show that morphine was almost half as effective when you didn't know you received it. In other words, the effect of a drug is a combination of the pharmacology of the drug and the effect of your brain knowing that you're having the drug and the therapeutic ritual of the drug administration. That component is the placebo effect, and that's what we're studying.
What we're really talking about here is what has been almost misnamed the placebo effect, the brain's own healing mechanism. And the reason it's misnamed is it's usually the placebo effect. The word placebo is usually preceded by a 4-letter word, just. Oh, it's just the placebo effect. Well, it's not just the placebo effect. It's a very powerful effect that contributes about 30 to 50% of the effect of any biological cure.
Belief is critical because belief has the ability to trigger part of the overall healing response, if you like. In simple terms, belief is part of why we get better. It's not the complete answer, but it's one part of any medical treatment which is important. And that's both at a patient level having belief and at a doctor level realising that belief is important, and the communication about some of these things with the patient is important as well.
My name's Ian Gawler. I started off my working life as a veterinarian, but after just a couple of years of being in practice, I got a swelling in my right thigh, which turned out to be a very aggressive form of bone cancer. And so in the beginning of 1975, I had my leg amputated through the hip. And it got worse because less than a year later, the cancer reoccurred. Nobody on record had lived more than 6 months with that particular type of secondary cancer. And most people seem to die within about 3 months. Being a veterinarian, I'd seen animals healing through their own natural agency, if you like. And so that set me off on this sort of quest for healing. And I was very fortunate because I was around in the early days of mind-body medicine, when meditation was just starting to be used therapeutically, where nutrition was starting to be taken by some people seriously for its therapeutic value. And that whole role of the mind and emotions in health was being considered. As I was putting all this effort into getting well, I reached a point where it was very apparent that my mind was the limiting factor. Because up to that point, I'd been doing all these things that had the possibility of helping me to recover, but it became apparent at that time that I had some level of doubt about it. I was told about this Indian holy man named Sai Baba, who was revered in India at the time as a divine incarnation. I must say, of all the people I met through my healing journey, in terms of presence, and in terms of fulfilling the expectation of what one would have of a really extraordinary holy man, he really fitted the bill. And he said to me very clearly, very directly, "You're already healed, don't worry." And he'd sort of picked up on the fact that there was this doubt sort of there. And with doubt, you hang back a bit. And although from the outside, I would have looked like I was very committed, very engaged with this whole healing process, I know it was a fact that there was this level of doubt there that was sort of holding things back. And through the agency of meeting him and the catalytic effect that he had and the sort of power of his presence, which is like what made him, for me, a true healer, I was able to actually switch that. And I came away from there with conviction. And it didn't actually change what I was doing, but it changed how I was doing it in this quite deep and profound way. And so everything from then on, I thought, this is, I came away, thinking that I'd really get well.
In recent years, the scientific line of inquiry has moved from being not if, but how belief affects your health. And while the study of placebo responses still has a long way to go to influence the practices of conventional medicine, scientists are starting to uncover a physiological basis for placebo. Neuroscientists can see placebo treatments prompt chemical responses in the area of the brain that modulates things like mood, sleep, and pain reception in a similar way to drugs. research on the brains of people with Parkinson's disease has shown that placebos increase dopamine, a chemical that affects emotions and sensations of pleasure and reward. In a study of patients with irritable bowel syndrome, people got better even when they knew pills given to them were fake. These people were told their doctors felt the pills would help, and they did.
This is a really important reminder that the therapeutic interaction between the therapist, any healthcare professional, and the patient is important. And I think people have known that for years. And now we can, through placebo research, demonstrate that it's important because there's a clear biological manipulation or altering of symptoms.
I think healing response is a better term than placebo response because in most doctors' minds, placebo responses, people only think of giving sugar pills and saline injections. So this is fooling patients, it's duping them in some way. And doctors don't like to see themselves as duping patients. And patients certainly don't want to see themselves as dupes. So I think to avoid all that, I would tend to talk about these as mind-mediated healing responses.
Now, it doesn't mean, I think I'm going to get rid of my cancer or my, other major illness. It's just going to go away. But it does mean that the body's response to the insult of an infection or a tumor or something else may be modulated by central nervous system effects, including expectation and placebo.
There's no way you can ever draw a line and say on this side are the intrinsic effects of treatment and on this side are the mind-mediated effects. And not only is it impossible to do that, it's foolish to do that because to me, the placebo response is the meat of medicine. That's what you're trying to make happen.
It wasn't like I found some magic medical thing that fixed me or some alternative treatment that fixed me. I think if there's a magic bullet involved in my case, it was actually that sort of inner capacity for healing and activating that. After I recovered, a lot of people heard about my story and wondered what I'd done and whether it could be of help to them. And really my stories got less and less significant in that sense because the real body of the work is the testament of all the people who've done these things over many years.
A friend had mentioned the Gawler Foundation to me. Straight away in this program, things started to make sense to me. Like full light bulb moments. I was motivated and I was keen to stay alive. I just got married. I was 27. I didn't want to die. And I made a lot of changes.
I had no trouble in saying, I don't care what the odds are, you're an individual, you've got a body, you've got emotions, you've got mind, you've got a spirit, it's possible you can recover. A lot of the people that I've helped that have managed to recover sort of in spectacular ways against difficult odds have found that point of conviction at some point in their own healing journey.
They teach you about the effects of emotions on your body, your immune system, the importance of meditation, nutrition, having some sort of spiritual connection to whatever it is you believe in, all these things. And they're all things that you can do for yourself. So some people say that my healing is this miraculous recovery. But to me, it was just hard work and perseverance and belief. I believed these things, were good for me. The easiest way to sum it up for someone is, would I have got well without all these approaches like meditation and essentially looking after yourself? No. Would I have got well with just that and no chemical intervention? Maybe. But if you wanted to break it down, the drugs weren't going to cure me, not by themselves. I was a terminal patient. I had stage 4 melanoma. And here I am, cancer-free 6.5 years later.